Hi, my name is Arch Robertson. I work as an environmental health specialist for the Arkansas Department of Health. I'm here today to explain to you, the governing body of Arkansas, why I believe a policy change in the availability of restaurant health inspections to the public needs to happen. In this presentation, I will give a brief discussion as a refresher for everyone in attendance who I'm sure do not deal with food safety every day like myself, on why food safety is important, how our current inspection reports function, and another possible type of report that may function better if the switch I recommend of making inspection reports publicly available occurs, the current availability of restaurant health inspections, and why on-site posting and online posting of restaurant health inspections should be done. So why is food safety important? Well, the Arkansas Department of Health estimates that 76 million illnesses, 325,000 hospitalizations, and 5,000 deaths are attributed to foodborne illness in the United States every year. The CDC estimates these numbers to be 48 million people getting sick from a foodborne illness, 128,000 hospitalized, and 3,000 dead. These differences in numbers are largely due to the fact that most foodborne infections are undiagnosed and unreported, making it difficult to get the exact numbers. But as you can see, foodborne illness affects a massive amount of Americans every year. Although there are a large variety of common germs that cause food poisoning, many of the symptoms are similar. Upset stomach, stomach cramps, nausea, vomiting, diarrhea, and fever are all common symptoms of different types of food poisoning. The CDC recommends you see a doctor if you have bloody diarrhea, a fever higher than 102 degrees Fahrenheit, are vomiting frequently, are dehydrated, or have diarrhea for more than 3 days. Besides these symptoms and the possibility of death, another reason that foodborne illness is so serious is because anyone can get a foodborne illness. Although certain groups such as the elderly, children, pregnant women, and immunocompromised groups such as people with HIV and AIDS are more susceptible, anyone is able to get a foodborne illness. Researchers have identified more than 250 foodborne diseases, according to the CDC. Norovirus, Salmonella, Clostridium perfringens, Campylobacter, and Staphylococcus aureus are 5 of the most common types of foodborne illness. Norovirus usually affects people between 12 and 48 hours after eating or drinking, and symptoms include diarrhea, stomach pain, nausea, and vomiting. Salmonella affects people between 12 and 72 hours after eating, and the symptoms include diarrhea, fever, stomach cramps, and vomiting. Clostridium perfringens affects people between 6 and 24 hours after eating, and the symptoms include diarrhea and stomach cramps. Campylobacter usually affects people between 2 to 5 days after eating, and symptoms include diarrhea, stomach cramps, and fever. Staphylococcus aureus affects people between 30 minutes and 6 hours after eating, and the symptoms include nausea, vomiting, stomach cramps, and diarrhea. As you can see, the incubation periods for different foodborne diseases lead to misleading reports on the time and the source of the infection. This misinformation is one of the main reasons that it can be difficult to pinpoint where foodborne illnesses come from. Because of this, the use of food safety inspection reports is the best way to monitor the risk factors that have been shown to cause foodborne illnesses. Inspection reports in Arkansas are currently done by an observation system in which the environmental health specialists make observations of the violations of the food code and mention ways that the violations can be fixed in the report. These observations are written out under the items listed as out in the report. Restaurants in the reports are designated a category of either 1, 2, or 3. 1 being low priority restaurants that are only inspected once a year, 2 being the medium priority restaurants that are inspected twice a year, which comprises most of the restaurants, and 3 being the high priority restaurants that need 3 inspections a year. Items in the report can be marked either in, out, not observed, or not applicable. In meaning that the item is in compliance, out being out of compliance, not in/O being that the item was not observed during the inspection, or in/A meaning the item is not applicable for the restaurant. Under the out section of these items is where you'll find the observations that are listed and the ways that they need to be fixed. Violations can either be critical or non-critical. Critical items for reports are items that are the most likely to lead to foodborne illness, whereas non-critical items are less likely to immediately lead to a foodborne illness. At the end of the report, the temperatures are recorded. The temperatures should be below 41 degrees Fahrenheit for cold-held food and above 135 degrees Fahrenheit for hot-held food. A possible change in this system to a letter grade or point system to make the reports easier to understand when made publicly available may be an effective change, as these types of systems are easier to understand for laymen. However, in the study Restaurant Inspection Scores and Foodborne Disease by Jones, Pavlin, LaFleur, Ingram, and Schaffner, many inspections were shown with scores higher than 90 having critical violations, and some restaurants with scores less than 80 not having any critical violations. So this is an obvious flaw with this kind of system, and Jones, etc. all concluded that as well, that the data served as a reminder that overall score alone is not necessarily a sufficient measure of restaurant safety. Despite flaws like this in a letter grade system, I believe the understanding for the everyday person that a point system allows for, and the expedited understanding of just seeing a letter grade or a point score immediately allows for, would be a very good change in our system for the everyday person. These food inspection reports are currently not available in the state of Arkansas to the public, for the public. This needs to change. Reports should be made available because public awareness has been shown to increase food safety in restaurants. Evaluations of programs in New York City, Los Angeles, and Toronto have all shown use by consumers, as well as increases in safe sanitation practices in restaurants. These evaluations have also shown program approval and have shown decreases in foodborne illness in the respective cities. I believe that a twofold availability for the public should be used in the state of Arkansas. Making the reports available publicly through the internet using the Arkansas Department of Health's website, healthy.arkansas.gov, as well as making the reports available on site at restaurants at the point of decision making for the people of Arkansas. Online posting of health inspection reports raises public awareness on the safety of the restaurants that they eat at. Increased public awareness is generally thought to be one of the driving motivators that has caused the increase in health safety seen when reports are publicly disclosed. A study in Salt Lake County, Utah, impact of internet posting of restaurant inspection scores on critical violations by Blake Waters, Vanderslice, Perugznik, Kim, DeLige, and Durant shows that web-based reporting systems in Salt Lake County have led to decreases in certain critical violations being observed. Another helpful feature of online posting is the possible collaboration with social media sites that people use to get information about restaurants, such as Yelp. In their study, online reports of foodborne illness capture foods implicated in official foodborne outbreak reports. Insosi, Gordon, and Brauman reported that, quote, "We observed that reports of foodborne illness on Yelp were sometimes extremely detailed, which could be useful for monitoring foodborne illnesses and outbreaks. We also located clusters of reports for particular restaurants, some of which had health safety violations related to food handling and hygiene. This suggests that tracking reviews in near real time could reveal clusters useful for outbreak detection. Most importantly, we found that foods implicated in foodborne illness reports on Yelp correlated with foods implicated in reports from the CDC. This could be useful for identifying food vehicles for attribution and estimation of the extent of foodborne illness." These are just the first steps of a future tool that could be used by environmental health specialists in the state of Arkansas if inspection reports are made available online. Despite these benefits that online posting of inspection reports brings, the study Impact of a Letter Grade Program on Restaurant Sanitary Conditions and Diner Behavior in New York City by Wong, McKelvey, Ito, Schiff, Jacobson, and Cass states or found that the financial disincentives and the website posting already in place in New York City before the implementation of a letter grade system requiring public disclosure at point of decision making were not able to actively increase health safety, as most restaurants were still being cited for multiple public health hazards. Which is why I believe on-site posting of the report should also be available as well as online posting. On-site posting, as discussed throughout this presentation, has been shown to improve sanitary practices in restaurants. Several studies done in on New York City's letter grade system, as well as similar studies in Los Angeles and Toronto, have shown this to be the case. One of the main arguments against this system is possible financial disincentives that may occur to the restaurant industry due to implementation. In Is Public Grading Worth the Costs? An evaluation of New York City's restaurant grades policy, Meltzer, Rothbart, Schwartz, Calabrese, Silver, Mijanovich, and Weinstein suggest that their inconclusive revenue results show, quote, that restaurants overall are not necessarily benefiting from more business, but they are not being deprived of business either. Therefore, the economic implications appear to be less pronounced than any health-related food safety outcomes on which the policy clearly improves." End quote. I agree with this opinion, and any financial outcome effect will be nowhere near the health safety improvement that comes with making the inspections public. For these reasons, I believe that implementing multiple ways for the public disclosure of health inspections for restaurants in the state of Arkansas will increase food safety in Arkansas. Thank you very much. In this report, I responded to the prompt I was given, which asked me to argue if the health department should make its restaurant inspection reports public. So that is what I discussed. However, in actuality, the Department of Health has made health inspections available, and on this page is the link to that portal in case you want it. And you can find the reports for the entire state there. I think this portal has been beneficial, but I believe, like I argued in my presentation, that an on-site posting of the report should still be implemented.